I've had a lot of good requests recently for topics for videos, and I plan to do as many as I can. The only exception is I don't want to do a video on a topic that I know nothing or very little about, or for which I've never seen a patient with the condition. Today I'm going to do a video on a very common disease that I see all the time in disability patients, and that's diabetes. Hello, I'm John Foster. I'm a medical doctor who does Social Security disability exams. And as usual, everything I say reflects my own opinions based on my own experience and study, and not the opinions of the Social Security Administration or any other medical body. Now, this video is probably going to be longer than usual because there's a lot of ground to cover, but I think if you have diabetes and you're involved in the disability process, you'll find it helpful. I'm going to talk about the disease itself, the things about the disease that can cause disability, and then about the complications of the disease, which are the most common reasons for disability. So in diabetes, the blood sugar is higher than it should be. We always have some sugar called glucose in our blood. It provides us with energy, and our body keeps it tightly regulated so that it doesn't go too low or too high. That regulation is mostly controlled by two hormones. When we eat a meal, the sugar and starch in our meal, and the starch is digested into sugar, raise our blood sugar. And then our pancreas, which is a gland in the abdomen, it sits behind the stomach, secretes a hormone into the blood called insulin. Insulin makes the blood sugar go down by driving the sugar into our liver and muscles. When our blood sugar goes too low, which usually happens when we haven't eaten for a while and we exercise, the exercise burns up sugar in the blood, our pancreas secretes a hormone called glucagon, which drives that sugar out of the muscles and liver into the blood. And in a healthy body, that regulation is pretty good. In diabetes, that regulation breaks down and our blood sugar tends to be too high. Not only that, but normally we have no or just a tiny amount of sugar in our urine. And in diabetes, we tend to get a moderate or large amount of sugar in our urine. And if you find this helpful, you might want to subscribe to my channel. I generally put out one disability-related video per week. Now, there are two main types of diabetes, and it's important to know the difference. In type 1 diabetes, the body either stops making insulin or makes just a very little insulin, so blood sugar goes quite high. This usually happens somewhere between toddlerhood and young adulthood, although it can happen at any age. In the old days, these folks would get a very high blood sugar, and they would die within about 2 weeks of the onset of illness. It was a real tragedy for parents to have their young child become sick and waste away and die in about 2 weeks. Dr. Frederick Banting and his colleagues discovered insulin and provided the first treatment that would save the life of these children and young adults. And for that, they received the Nobel Prize in Medicine in 1923. The second type of diabetes, called type 2 diabetes, usually comes on later in adulthood. And in this type of diabetes, the pancreas makes a normal amount of insulin, but the body is resistant to insulin. Although there's plenty of insulin in the blood, it just can't do its work. People with type 2 diabetes don't die soon after the onset of the disease, unlike untreated people with type 1 diabetes. Type 2 diabetes is related to obesity. Type 1 diabetes is not. And type 2 diabetes comes on later in life. When I was a medical student around 1977, I spent some time in a diabetes clinic. And the youngest people with type 2 diabetes were all in their 60s. Now, with the obesity epidemic, we are seeing teenagers with type 2 diabetes, which is a real tragedy, as I'll explain soon. Now, diabetes alone, which may occur without any problems, will not help a person qualify for disability. What will help people qualify, and often do result in approval, are problems related to the disease itself and complications of the diabetes. There are 3 problems related to the disease itself. People with type 1 diabetes who don't get insulin or don't get enough insulin can develop a condition called diabetic ketoacidosis. In that condition, the blood sugar becomes high and the blood becomes acid. And there's a bunch of other problems that I won't get into because they're too technical. This is a very serious disease, and people with it are admitted to the hospital and usually treated in the intensive care unit. The second condition is hypoglycemia. In hypoglycemia, the blood sugar goes too low, and this is almost always caused by a person giving themselves an injection of insulin. Insulin can only be given by injection. If you take it by mouth, it's digested in the intestines and none of it gets in the blood. So the person takes an ingestion of insulin and then misses a meal or two. And if the blood sugar goes too low, the person can go into a coma, completely unconscious. And it's a very gratifying thing to treat in the emergency department, because basically what you do is give an intravenous injection of about 2 ounces of sugar syrup, and within a minute or two, the person goes from being completely unconscious to completely awake and normal. The third problem with the disease occurs with type 2 diabetes only, generally in elderly people who have a complication such as pneumonia, and this is called a non-ketotic hyperosmolar state. In this condition, the blood sugar goes extremely high, higher than in diabetic ketoacidosis. But the blood does not become acid. And again, this is a critical illness, and these people are admitted to the hospital, almost always to the intensive care unit. All 3 of these conditions are relatively rare, but there are a few unfortunate people who have what's called brittle diabetes, which means diabetes that's extremely difficult to treat and regulate. And they may bounce between hypoglycemia, ketoacidosis, back and forth, and either be in the emergency department or admitted to the hospital multiple times. Those are the folks who may qualify for disability based on their diabetes alone. And if you've ever had to go to the emergency department or been admitted for diabetic ketoacidosis, hypoglycemia, or non-ketotic hyperosmolar state, you really need to get those hospital records to Social Security, because that may be your ticket to getting approved for disability. Now I'm going to switch and talk about the complications of diabetes. Complications of diabetes tend to occur after the diabetes has been present for a while, generally 5 to 10 years. And the complications tend to be progressive, which means that they get worse with time. So the initial manifestations of the complications may not qualify a person for disability, but as they get worse with time, they may very well qualify. The first is problems related to the eyes, and there are two complications related to diabetes. The first is cataracts, where the lenses in the eye become cloudy, and the second is what's called retinopathy. That's where the inside lining of the eyeball, the part that actually detects the light, becomes damaged due to diabetes. And both of these complications can cause low vision or even complete blindness. Social Security always wants to know if a diabetic person has diabetic retinopathy. And this is best diagnosed by an eye doctor. And people with diabetes should see an eye doctor once a year. So if you have diabetes, make sure that your eye doctor reports are sent to Social Security. The second important complication of diabetes is vascular disease. Diabetes contributes to hardening of the arteries and poor circulation. This can cause strokes in the brain. It can cause heart attacks and heart failure in the cardiac system, and it can cause hardening of the arteries in the legs, which causes a condition called peripheral vascular disease. In the legs, there can be complications that become so severe that there's infection or gangrene, and the person may require an amputation, anything from amputation of toes to amputation of a foot to amputation of the lower leg. And certainly if you've had any of those problems, you want Social Security to get the records. The next issue is the kidney. Diabetes can cause kidney damage, which is called diabetic nephropathy. Now, this is a condition that you won't know that you have because it doesn't cause any problems or make you feel sick until it's very far advanced. So this is a condition where the diagnosis mostly results on tests of the blood and urine. In diabetic nephropathy, a test called the blood urea nitrogen, generally called BUN, becomes high, and a test called creatinine, sometimes abbreviated as CR, also becomes high. And a third test called estimated glomerular filtration rate becomes low. These tests should be on your annual, or more frequent than annual, blood tests that your doctor orders. And I would make sure that Social Security gets copies of these tests. They consider diabetic nephropathy a serious problem. In your urine with diabetic neuropathy, you get protein in the urine. Normally, there's either no or a tiny amount of protein in the urine. The worse your kidneys get, the more protein you get in your urine. The next area of the body that diabetes can affect is the nervous system. I've already mentioned stroke, but a more common diabetic complication is peripheral sensory neuropathy, and this usually begins in the toes and works its way up the legs, and if it becomes more severe, affects the fingers and hands as well. In this condition, there's a combination of numbness and often what doctors call paresthesias, which are painful sensations kind of like prickling or tingling or electric shocks. This complication can make it difficult to walk and also difficult to balance because it's hard to balance if you can't feel your feet. Another less common diabetic nervous system complication is gastroparesis. In this case, the nerves that cause your stomach to push food through your digestive system fail. So the food tends to stay in the stomach, and people feel bloated and nauseated and get cramps, sometimes even vomiting after a big meal. The final nervous system complication of diabetes is pretty rare. It's called mononeuritis, and in this case, one nerve in the body, and it can be any nerve, stops working all of a sudden. Usually it regains its function gradually. Now, I've talked in the past about erectile dysfunction and how it's generally not considered a disability. But in diabetes, that's a bit different. Diabetes can cause erectile dysfunction by two mechanisms. The first is neuropathy can damage the nerves to the penis, and the second is hardening of the arteries can reduce the blood flow to the penis. So in a person with diabetes, erectile dysfunction can be an indicator that they have both neuropathy and hardening of the arteries. Now, if you're involved in the disability claims process, you want to list all the problems and complications associated with your diabetes. You want to make sure that you've had your blood and urine tested within the past year and that Social Security gets those results. Social Security always likes to have specialists' opinions, and the type of doctor that specializes in diabetes is called an endocrinologist, and if at all possible, you want to see an endocrinologist before you apply for disability. Finally, Social Security particularly wants to know about ketoacidosis, hypoglycemia, retinopathy, nephropathy, and neuropathy. They often ask if those conditions are present in the exam for the patient with diabetes. Well, I hope this has been helpful, and as always, remember, if it happens, it's possible.